when some certain guys enter the pharmacy, they'll first stay around, for the first 30 seconds to 1 minute. And some of them will quietly meet somebody in the pharmacy and ask, please, can I speak with the pharmacist on duty? And when they finally meet us, some of them will be like, oh, I have heard so much about Viagra and Cialis. Which one should I use? Or some of them will be like, oh, I've been using Viagra for some time now, but I read somewhere that there is one that is much more effective than Viagra. Can you educate me? So if you're a guy, bring your chair closer because we're about hitting the road. Today we are comparing sildenafil, commonly known as Viagra, and tadalafil, famously known as Cialis. Two of them are actually used to treat erectile dysfunction. But how do they differ, and which one should you choose? Hello and welcome. My name is still Pharmacist, and I'm going to be your anchor on today's topic. First of all, let us define what an erectile dysfunction is, because that is what Cialis and Viagra are used to manage. So erectile dysfunction is the inability to obtain or maintain an erection firm enough for a satisfying sexual intercourse. The causes of erectile dysfunction have been broadly put under 4 factors, and I'm going to be mentioning these factors to you, so please pay attention. Number 1 factor is called physical factors. Physical factors could be caused by poor blood flow, and poor blood flow can be caused by heart diseases, diabetes, and high blood pressure. And other physical factors could be obesity, low testosterone, and nerve damage. Another factor is psychological factor. When you have issues like stress, you have anxiety, depression, or relationship issues, these things can affect your arousal. I usually tell people that the journey to a satisfying sexual intercourse actually starts from the brain. So when you have a mental clip, this can affect your arousal and ultimately your erection. The third factor is lifestyle habit. It goes without saying that habits like excessive alcohol intake and smoking can actually affect your erection. Then lastly, medication. There are some medications that would actually affect your erection. Medication like some certain antidepressant and some blood pressure medication. So this brings us to the question of Cialis and Viagra once more. So let us do a comparison and know which one you should actually take to your next vacation or honeymoon. When we talk about speed, Viagra is actually your go-to guy. I call it the Usain Bolt of erectile dysfunction drugs. So it actually takes about 30 minutes to an hour for its effect to start taking place in your body. But here's one thing. Viagra is usually affected by food, but on the other hand, it takes Cialis about 30 minutes to 2 hours for its effect to start taking place in your body. But again, it is not affected by food. So if you're planning a dinner date before the action begins in the other room, Cialis is actually a preferred choice. So this is where Cialis actually shines. Cialis can last up to 36 hours. That's right, 36 hours. 36 hours. That is a day and a half. And that is why some people refer to it as the weekend pill. While on the other hand, Viagra can last you up to 4 to 6 hours. It is better for a more planned effect, and it is not quite the marathoner that Cialis is. So if you're still confused as to which one to pick between Cialis and Viagra, here's the deal. If you want something with greater flexibility and longer coverage, Cialis is your go-to person. But if you want something that is short-acting and it's fast, Viagra is your guy. So we've made the choices open to you. It is left for you to pick which one would suit you. But I need to remind us that these drugs are not lifestyle drugs, so it actually needs to be taken under the supervision of a pharmacist or a doctor. So we've come to the end of today's topic. But again, if you've not subscribed to this channel, I am wondering what on earth you're still waiting for. Please hit that subscribe button. I will see you in my next video.